Now for PROM and AROM. Now for the pathophysiology. As you know, the baby's floating in this amniotic fluid within the chorioamniotic membrane making up the amniotic sac. This is held inside the uterus, which we call the baby condo, since this is where the baby lives during fetal development. And the cervix is the door to the apartment that holds it all in. So in PROM, the mother's water breaks too early and this amniotic fluid leaks out. Now PROM has two classifications, either rupture before the onset of labor or PPROM, preterm premature rupture of membranes, before 37 weeks gestation. So go ahead and pause the screen and look at the differences between the definitions. The key term is when the rupture of membranes happen. Now in terms of risk factors, this includes anything that weakens the strength of the chorioamniotic membrane. Remember, this is the bubble of amniotic fluid that the baby floats in. As you can see, this is located inside the uterus right behind the cervix, the door to the uterus. Now, risk factors include infections that will weaken these membranes. For example, UTI, that urinary tract infection, STIs or STDs, as well as bacterial vaginosis. And even short cervical length, smoking actually doubles the risk, and abdominal trauma. And even prior distension of chorioamniotic membrane. These include polyhydramnios, that increased amniotic fluid, and multiple gestation, where the mom has twins or triplets, and even more. Basically a pregnancy with more than one baby at one time. Remember Octomom, who was in the news a while back? Now she was carrying 8 babies here. Talk about a lot of distension on the amniotic membrane. Now moving on to diagnostics. Clients may report obvious gush of fluid or even a steady flow of leakage. So a big test we do is nitrazine test. This is similar to litmus paper. Some vaginal fluid is placed on the paper, and we expect it to change color from yellow to blue because the pH of amniotic fluid. Now this is done to confirm if the membrane has actually ruptured and is now leaking that amniotic fluid. But this is not the best test, as it can change color due to infection, blood, and even other factors. So this cannot be used by itself to determine PROM. Another test we can do is speculum exam, also called pooling, to confirm rupture of membranes. So a speculum is placed inside the vagina and the client is asked to cough or even bear down. Now here's the key point. If amniotic fluid is seen coming out of the cervix when this pressure is applied, then the client has ROM, that rupture of membranes. We can also use an ultrasound that monitors for less amniotic fluid in the uterus, but it is not the best tool to diagnose or confirm rupture of membranes. And lastly, we can always screen for STIs, those sexually transmitted diseases. Now switching gears to symptoms, we see pelvic pressure, small leakage of fluid or even a steady flow, as well as pink discharge, and temperature is critical. If mom has a fever, we will treat with antibiotics and even antipyretics for sure. Now, if the water breaks and the client is over 37 weeks gestation, the key term there is over 37 weeks. 90% of clients will go into spontaneous labor within 24 hours. But if the client does not go into spontaneous labor on their own, then the labor should be induced with oxytocin due to a big increased risk for infection, as the amniotic membranes have ruptured, which is the biggest defense barrier for the baby. So we have a huge risk for infection. Now, in terms of nursing care, it is a priority to give prophylactic antibiotics to prevent GBS infection, that group B beta streptococcus infection. Huge NCLEX tip, so be sure to write that down. Prophylactic antibiotics. Now, this is very serious in terms of infection because it can be transmitted to the newborn during delivery, resulting in a deadly complication like neonatal GBS sepsis and even pneumonia. Now, if GBS status is unknown, then antibiotics are typically ordered for 3 reasons. So number 1, membranes have ruptured at or over 18 hours. Number 2, temperature over 100.4. And number 3, gestation less than 37 weeks. So please be sure to pause the screen and write those down. Now Saunders mentions, a pregnant client, 39-week gestation, has a positive group B streptococcus, or basically GBS. The cervix is dilated 6 centimeters and 90% effaced. which should be the nurse's first action? Call the HCP, the healthcare provider, to obtain a prescription for intravenous antibiotics prophylaxis. Remember, we have to give those antibiotics. Now moving on to AROM. Remember, AROM is artificial rupture of membranes. So just look at the chart here. A is for artificial, R for rupture, and O for of, and M for membranes. This is also referred to as amniotomy. This is a procedure performed by the HCP to manually induce labor by rupturing the amniotic membrane, or in other words, breaking the client's water. Now this causes a huge risk for umbilical cord prolapse, which results in causing fetal bradycardia due to cord compression if the fetal head is not engaged in the pelvis. So please be sure to write down these 4 key interventions and big NCLEX tips. Number 1, assess the fetal heart rate before and after. This is always the first priority, as fetal bradycardia may indicate deadly cord prolapse. Number 2, assist to upright position after the AROM procedure. This allows for drainage of the amniotic fluid and ensures that fetal head remains firmly connected inside the pelvis. So many students get this wrong, thinking that supine position is best, but no, it is not. Supine position is bad in this case, as it decreases uteroplacenta blood flow and fetal oxygenation. So sit upright after AROM. And number 3 is a temperature done every 2 hours because we can spot infection. And number 4 is characteristics of the amniotic fluid. We want to look for color, amount, and odor. So normal amniotic fluid should be clear or colorless with no foul odor. Now what's not normal and may indicate infection is yellow-green fluid that also may indicate meconium, and strong foul odor that once again may indicate infection. So don't let the NCLEX trick you here. This procedure is painless. However, the client may experience some pressure and slight discomfort. So Hesse mentions, for an amniotomy, immediately after the procedure, what is the most important information for the nurse to obtain? Fetal heart rate. Remember, fetal bradycardia could indicate that cord prolapse. And ATI, amniotomy. Which of the following is the priority for assessment by the nurse? Again, fetal heart rate. Remember, we don't like slow heart rates in the fetus because that could indicate a cord prolapse. All right, that wraps it up. Thank you so much for watching. Don't forget to take